Hello and welcome to On Life Health's informational webinar series. I'm your host, Michael Detner. Today's topic is Women and Weights, the top 5 benefits of strength training with Barbara Johnson. Barbara has worked as a dedicated health coach here at On Life Health for a year now. Prior to coming to On Life, she spent 7 years as the Wellness and Personal Training Coordinator for the YMCA in Brentwood, Tennessee. Barbara has a bachelor's degree in psychology from the University of Wisconsin. She is also certified as a personal trainer through the National Strength and Conditioning Association, as well as the American Fitness and Aerobics Association. Most recently, Barbara received her certification as a health fitness specialist from the American College of Sports Medicine. Over the years, Barbara has helped many people find the motivation it takes to make dramatic improvements to their health through exercise. Today, she'll be talking about the important role that strength training plays in women's health, and along the way, we'll look at some popular ideas about this topic, some of which are true, some of which are not. And now, please welcome Barbara Johnson.
Thank you, Michael. I'm excited about this topic today. First off, I'm going to give you a little bit of an agenda. We're going to talk about what strength training is, and then we'll discuss the benefits of strength training, especially for women. And as you mentioned, there'll be some of the common questions and concerns that most people have about strength training. I would like to point out that as this discussion goes on, I may use the words weightlifting or resistance training, and those are synonymous with strength training. Well, what is strength training? It's a method of improving muscular strength by gradually increasing the ability of a muscle to resist force through the use of free weights, machines, or your own body weight. The first thing we want to talk about today as a benefit of resistance training is that it will improve your physical strength. Being stronger is something that can benefit everyone at any age. There have been a lot of research studies done that show that when you start doing resistance training for at least 2 to 3 days a week, consistently for several weeks, you'll be able to increase your strength by 30 to 50%. Now, the 50% increase is probably going to be more with someone who has never done any type of strength or lifting work at all. You'll also be able to make your daily living easier, anywhere from lifting several bags of groceries, baby carriages, bags of mulch, bales of hay. All of those things will be much easier. You'll be more independent, and you won't have to always ask for help from other people. Increase in self-confidence. This is huge. When you know that you're stronger because you're now lifting heavier weight than you were when you started the program, you feel better about yourself. You know you can be more independent. There's several research studies that have been done that show that building up someone's self-confidence through weightlifting definitely occurs. Specifically, women who have had cancer surgeries where lymph nodes and all have been removed in their arms, they not only do they feel better about themselves, but the swelling that sometimes comes because the lymph nodes have been removed is decreased dramatically. Of course, exercise in general, including weightlifting, also helps to reduce your risk for breast and colon cancer.
Barbara, one particular concern that we often hear about women and strength training is women will get bulky muscles if they do strength training. Is this true or false?
That's false, Michael. There's 2 main reasons why this is not going to happen, and those are testosterone and a type 2 muscle fiber. Let's talk about testosterone first. Of course, women do have some testosterone, just like men have some estrogen. But men have 10 to 20 times more testosterone than women. So since women lack that amount of testosterone, that will keep them from getting big, bulky muscles. The other thing that's very interesting has to do with the muscle fibers. There are 2 main types of fibers, type 1 and type 2. There are several subcategories in both of these, and we're not going to talk about those. But for our purposes, the type 1 fiber is long and slim, and it's usually used for endurance. The type 2 fiber is larger and bulkier, and it's used for quick reactions. When you lift weights, you're actually building more of the type 2 muscle than you are of the type 1. Women have less type 2 muscle all over their body than men do. So women won't get as big because they have fewer type 2 muscle fibers. The next thing that's very important about strength training is dealing with osteoporosis. Osteoporosis affects 10 million Americans every year, and 80% of them are women. Menopause has a lot to do with the increase of osteoporosis, and one of the reasons is about 5 to 7 years after women have completed menopause, they start losing and can lose up to 20% of their bone density. Of course, when your bones are more fragile, being less dense, you're more susceptible to bone fractures. Bone fractures occur mostly in the wrists, the hips, and the low back area. Weightlifting helps to engage the muscle, and it puts strain on the tendons, and tendons connect bone to muscle. So your connective tissue is going to be stronger when the muscle gets stronger, and the bone becomes more dense through formation of bone when the bone is stressed because it's being pulled on by the connective tissue. That causes the bone cells to start making more bone, which makes your bone more dense. Studies have shown that after about 6 months of doing specific exercises that would increase the muscles in the low back and around that area, that the bone density of the spine will increase 9 to 13%. Now, I'd like to take a moment here to tell you about one of the reasons why I got involved in lifting weights myself. My mother had a stroke, and at one point she fell because half of her body didn't work anymore, and she wasn't able to stand very well, and she fell. So she broke her arm. We took her to the hospital, and the doctor informed us that he was going to have to put her arm back together with pins and rods. Her bone was so dense, he said it looked like a sieve, and he wasn't sure if the bone was going to heal, but he was going to do his best. Thank goodness it was on the affected side because she wouldn't feel anything. He also said to me that because this is my mother, that I probably had a genetic propensity to have a problem with osteoporosis as well. So needless to say, thank goodness I was lifting weights and became more involved in doing weights, and I've had my bone density done, and it's fine.
Another common concern that we hear is that women should only lift small weights as opposed to the larger weight that quote-unquote men should lift. Barbara, is this true?
It's false, Michael. Lifting heavier weights is actually more real to life. I often told clients that their handbag weighed more than a 3 or 5 pound weight. We want to be able to strengthen the muscle and use as little repetition as possible, and that saves the joints, especially as we get older. So when you lift a heavier weight, you can do less repetitions. When the heavier weight actually will do a better job of increasing your bone density as well. The American College of Sports Medicine recommends that people lift weights 2 to 3 times a week with a day off in between, that you do a set with each major muscle group and lift enough weight that you know you've lifted the weight. If you can lift more than 12 repetitions, then you need to add weight.
And of course, we do need to remind people, we always need to remind people that before starting any weightlifting or exercise program, it's very, very important that you consult preferably with your physician, and also it may be advantageous to you to find a personal trainer to guide you through this step by step. So just keep that in mind, please.
The next thing that's important about lifting weights is it will help to reduce your body fat. First off, muscle is an active tissue. It requires a blood flow and oxygen to keep it alive. Therefore, it burns calories. When you are just alive, you have what's called your resting metabolic rate. That's the amount of calories that it takes your body to either sit in a chair or just lay in bed. When you start moving, you burn more calories. Well, when you add muscle mass, because of the fact that it has blood flow and it uses oxygen, then you increase the amount of calories that your body has to burn just to be alive. If you weight train 2 or 3 times a week for about 2 months, you'll gain on average 2 pounds of muscle and you'll lose about 3.5 pounds of fat. In other words, each pound of muscle that you gain burns between 35 to 50 calories a day. That means that your resting metabolic rate has gone up. So even when you're just sitting at your desk, you're burning more calories because you've got more muscle mass.
Barbara, this is a very, very common concern for men and women alike, actually. The concern that muscle will turn back into fat if you stop training. Is this true?
It's false, Michael. Muscle and fat are 2 completely different types of tissue. For lack of a better example, picture a piece of steak in your mind before it's cooked. And you're going to see the red muscle tissue, and it's red because that's the blood supply that goes there. It's active. You have to burn calories in order for that to exist. The white that you see running in the muscle tissue or along the side, that's the fat. It doesn't have a blood flow. It doesn't need oxygen. It just sits there and takes up space. And the more fat you have, the more space it takes up. Muscle is more compact, and if you don't use the muscle, it doesn't turn to fat, it will shrink. Therefore, there's more room for fat to fill in the space, and when you don't have more muscle, your resting metabolic rate goes down, therefore you're burning fewer calories. Another way that strength training will help you is it will help to reduce your risk for heart disease and diabetes. These are 2 conditions that are at epidemic proportions in our country today. By being more active, whether it's doing cardiovascular exercise or strength training, and of course we recommend that you do both, you'll have a waist circumference that is within normal range. That is 35 inches and under for women and under 40 for men. That's just in case some of you guys are listening. Your cholesterol level will be lower, and that normal rate is anything below 200 for total cholesterol. Exercise also helps to increase your healthy cholesterol, that's your HDL. When you exercise, you're also going to improve your blood pressure, and normal blood pressure for young adults, anyone below the age of 60 is 119 over 79, and then 140 over 90 for people 60 and older. Your body weight will be at normal for your height and age, and being physically active, which includes the weightlifting 2 to 3 times a week, also includes at least 150 minutes of cardiovascular a week.
So Barbara, just so we're clear, you need to do more than just cardio to be healthy. Is that right?
Michael, that answer is true. Fitness, which is what we're all after, includes cardiovascular fitness, strength, and flexibility. Cardiovascular work, or cardio as it's known, helps to burn fat and increases the strength of your heart. Strength training helps to build more muscle mass, which improves your bone density and raises your resting metabolic rate. Flexibility is important because it helps to keep you range of movement in your joints, and that's especially important to people as we get older. It's also important to note that cardio and strength training and a healthy diet are what's recommended to help lose weight. And last but not least, by doing weight training, you will help to decrease your chances of injury, reduce back pain, and help to improve your arthritis pain. Strengthening your connective tissues and having stronger muscles helps to give more stability to your joints. And of course, that's where we have arthritis pain. It helps to reduce arthritis pain. The joints that you're going to be using when you lift weights are known as synovial joints. And synovial fluid is what goes in and out of the joint there. Just like oil in your car, synovial fluid helps to keep everything moving smoothly, and it helps to reduce the pain of arthritis. It also going to help to reduce and eliminate low back pain. Studies have shown that when you strengthen the low back muscles as well as stretch the hamstring muscles, 80% success rate in reduced pain and even eliminating pain. Will also improve your balance, and which helps to reduce your risk of falling. And when you have stronger bones and you fall less, you're certainly going to have less fractures.
Barbara, what about women, particularly elderly women, who say, I'm too old to start lifting weights? Is there a particular age when a woman just should not attempt this?
Well, first off, the statement of, I'm too old to lift weights is false. You can start lifting weights pretty much any time. As far as teenagers are concerned, you want to be careful with growth plates and that type of thing. But if you're an adult, you can start lifting weights. And of course, we'd like to recommend that young women start lifting weights so that they're building up their bone density and muscle mass early on in life. When you're an adult, and typically after the age of 50, both men and women start to lose muscle mass 5 to 7 pounds per decade. If you've been lifting weights before you hit age 50, you're going to slow down that loss of muscle, as well as you're going to have more muscle there, so that when the decrease in muscle comes, you'll still be strong. Research was done that showed that they could increase leg strength. They took a group of folks who were averaged aged 88, and they did a 14-week study where they did one set of a leg press at the appropriate weight for them. They were able to improve their leg strength 50%. Some of them were able to get up out of wheelchairs and maybe use a quad cane or a walker, and those that were using a quad cane or a walker were able to go without them. So there is never an age that you're too old to start lifting weights. Well, in wrapping up our webinar here on women and weights, I'd like to say that we picked 1 through 5, and they're all equally important. We just had to start somewhere. I'd like to say that when you do strength training, you will reduce your risk for obesity. And obesity is anything where your BMI is over 30. You'll reduce your risk for heart disease. Lifting weights will help you to lower your blood pressure, reduce cholesterol levels, and help to increase your HDL. Of course, that also includes cardiovascular exercise there. That also helps with heart disease. You'll reduce your risk for many types of cancer, also breast and colon cancer. You're going to reduce your risk for diabetes. There's studies that have shown that weight training for 4 months helped to increase glucose use by 23%. We've already talked about how you'll reduce your risk for osteoporosis and reduce your risk for low back. Another important thing that weight training will help you to do is reduce your risk for depression. There are several studies that show that people who take medication for depression, they had a control group of people who just took their medication and another group that took medication and exercised. And the group that exercised and took medication were much better off and were less depressed and had less symptoms than those who took just the depression medication alone. So weightlifting is something that all people should try to include, men or women, but especially women, because we do have the issues with osteoporosis, and it's not that hard to do. You can start out by doing some push-ups, and I encourage everyone to buy a set of weights at Walmart or Target and get started.
Barbara, a couple questions here. The first of all, it goes back to something you said earlier about taking a day of rest between weightlifting or strength training sessions. Can you tell us a little bit more about that and why it's important?
Sure, Michael. What's actually happening at a microscopic level is that you're kind of tearing the muscle fiber as you're doing the weights. And that day of rest in between allows your body to build back the little microscopic tears, plus make it just a little bit stronger and a little bit thicker. That's how you get a little bit bigger muscle. So that day of rest is your repair day.
The next is really more of a comment than a question, and I just wanted to reiterate the importance of strength training and exercise in general where mental health is concerned. You mentioned depression earlier. Strength training can be particularly effective in helping medication work better. It can help people feel better because of the endorphins and the brain chemicals involved with physical activity. They can give you a natural boost of dopamine, which is a feel-good chemical in your brain. But in addition to all the brain chemicals and so forth, one of the things that can really help with depression and anxiety is the fact that when you're taking care of your body and when you're making progress steadily, you do, as you said, Barbara, you do begin to feel a lot better about yourself. Your self-esteem improves, and your mood and the way you feel about life in general improves as well. So thanks for bringing that up also. Once again, Barbara, thank you for sharing your wisdom and expertise with us today. And a special thanks to all of you who decided to join us today. Thank you very much for listening. We do hope you found some benefit from the time that you spent with us. In the meantime, for On Life Health, this is Michael Detner. Be well.